Before patients leave their hospital room, have them lift their arms and attempt some typical functional movement to assess their balance point. Depending on how they balance, shift their hips to achieve an aligned posture, aiming to have their head and shoulders centered. Apply any assistive safety accessories such as chest straps, armrests, and lateral supports.
Correct posture is a very complex equation that has to take into account the person's needs, and it's ever-changing, depends on what their needs are at a specific moment in time, but you have to factor posture, their stability, their mobility, their physiological functions like the ability of the lungs to be able to accept oxygen, the compression on the digestive tract, the drainage of the urinary tract. If somebody's put into a slightly more hazardous situation, then take that into account, increase the stability, move the hips forwards, consider putting a chest strap on, consider applying anti-tippers to the wheelchair. When the person's sitting, say at a meal or at a computer, you don't have to have the same level of stability. You need to consider some of those other elements. They should be weighted more appropriately.